Hey, this is Jason. I'm one of the therapists here at Steppin Up Physical Therapy, and if you're watching this video, you're probably struggling with some shoulder pain. One of the most common types of shoulder pain is called impingement, or to use a normal word, it's just a pinching sensation that happens in the shoulder. As we raise our arm overhead, sometimes the humerus, the upper arm bone, can kind of get pinched underneath this protective bone called the acromion up top. So it's either pinching the bursa or the rotator cuff between those two bones. And so I'd like to show you 3 different things that could be helpful in reducing your shoulder pain. Okay, so one of the first of 3 exercises that you can do to help out with shoulder pain is simply a postural exercise, trying to open up the chest, get the trunk extended, and that reduces the likelihood that you're going to pinch the shoulder structures as you reach overhead. Great way to do this is to put your hands behind your back, come up into tall posture, and pinch those shoulder blades together. You can add to it a little bit if you want to do a chin tuck and make a double chin, and then relax. So you'll hold that for 5 or so seconds and repeat. Then once you get a little bit better at this, to add to the stretch, you can move your hands away from your low back. So you're up in tall posture, pinching the shoulder blades, chin tuck, and move the hands away from your low back. And you want to do this without leaning forward. This provides a nice stretch to the chest and works on your posture. Okay, so another exercise you can do to help out with that shoulder pain and regain some range of motion is called a wall slide. This one is going to help you get that arm all the way overhead. Probably one of the most common motions we lose when we have shoulder pain is the ability to reach up into that upper cabinet. So you're going to use a wall like this, put your forearm on it, and you're simply going to step forward and reach fully overhead, trying to close that gap between the underarm and your wall. If you can't get all the way overhead at first, that's okay. Still stretch into that discomfort just a little bit, hold it there a few seconds, and then back away from it. You want to repeat this perhaps 5 to 10 times, holding each one 15 seconds. Okay, we've done 2 exercises so far to address shoulder pain. Those both involved mobility and stretching. We need to throw one in there for strength. And a good exercise for that is simply taking your good posture like we talked about at the beginning, thumbs up, and you're going to come up to this position. If you have enough shoulder pain that you don't feel like you can hold weight, just keeping your arms in this position for say 15 to 30 seconds. And over time it seems to get heavy. That would be beneficial. After those get tired, you can go ahead and lower those down. What we don't want to see is any of this happening, okay? If you have one shoulder that's really painful, it may look like this if you look at yourself in the mirror. So let's keep those shoulders down, come up, pause, and hold for a while. If that is too easy, grab a soup can, or maybe grab 3 pounds. With this motion, you're not going to use a lot of weight. So again, I'm Jason from Steppin Up Physical Therapy. We just went through 3 exercises that could potentially be helpful for you to address your shoulder pain. Give these a try for a week. Do these 1 to 2 times a day. If you find that it's not getting any better, please reach out to a physical therapist and we can be of help.